When it comes to vitamin B3, most people don't realize they're navigating a biochemical fork in the road. On one path, nicotinic acid, the original cholesterol-busting, skin-flushing, liver-annoying superstar. On the other, niacinamide, also known as nicotinamide, the gentler, flush-free cousin you'll find in most supplements and skin creams. Both are technically forms of niacin. Both can be converted into NAD+, the molecule behind energy metabolism and cellular repair. But are they created equal? Not quite. And depending on your dose, your genes, and your liver's patience level, one form may quietly lead you into the land of 4PY, a metabolic no man's land associated with inflammation and vascular dysfunction. Let's start with the basics. Nicotinic acid and niacinamide both fulfill your body's need for NAD+ precursors. But their pharmacology diverges sharply beyond that point. Nicotinic acid has long been used at high doses, 1,000 to 2,000 mg/day, to lower LDL cholesterol and raise HDL. It works by inhibiting hepatic lipolysis, which reduces circulating free fatty acids and eventually lowers triglycerides. But that efficacy comes with a price: flushing, driven by prostaglandin-mediated vasodilation, and in some people, hepatotoxicity, insulin resistance, and gout. The liver gets quite grumpy when nicotinic acid piles up, and when it tries to detox the overload, it starts producing byproducts like nicotinuric acid and 4-pyridone 3-carboxamide for PY. 4PY isn't just biochemical confetti, it's a pro-inflammatory molecule. In several studies, elevated 4PY levels have been associated with increased VCM, one expression, that Velcro-like molecule that makes blood vessels sticky, oxidative stress, and endothelial dysfunction, the opening acts for cardiovascular disease. This becomes especially problematic in people with impaired renal clearance or methylation bottlenecks, where 4PY can linger and circulate like an unwanted party guest, triggering low-grade vascular mayhem. Meanwhile, niacinamide skips the prostaglandin pathway, so you don't get flushing. That makes it the preferred choice for skin health, NAD+ repletion, and most over-the-counter supplements. But don't be fooled by its mellow vibe. At high doses, niacinamide still gets metabolized into 4PY, just via a slightly different route. Studies have shown that even doses of 500 to 1,000 milligrams per day can begin to increase circulating levels of 4PY and N-methylnicotinamide, NMN, another metabolite that, while useful in small doses, can tip into pro-oxidant territory at higher concentrations. And just like nicotinic acid, this route can also tax the liver, especially in people with pre-existing metabolic dysfunction. So if you're using high-dose niacinamide because you heard it boosts NAD+ and supports longevity, you might be silently overloading your detox pathways, especially if you're also low in methyl donors like B6, B12, or folate. The result? Instead of supercharging your mitochondria, you might be generating toxic intermediates that clog your system and elevate biomarkers linked to aging and inflammation. Congratulations, your longevity strategy may be aggressively counterproductive. What's interesting is that both forms of B3 show diminishing returns at high doses, especially outside of clinical contexts. For lipid management, nicotinic acid only works at gram-scale levels, far above nutritional needs, and modern trials have failed to show meaningful cardiovascular benefits despite improvements in cholesterol markers. For niacinamide, many of the NAD+ boosting benefits are theoretical in healthy people and potentially risky at doses over 500 milligrams per day unless carefully monitored. As with many things in biology, more is not only not better, it can be metabolically confusing. So, which form is safer long-term? If you're looking for modest NAD+ support or just want to meet the RDA, 14-16 mg/day, niacinamide wins for safety and tolerability, especially when taken with food. But if you're using it at high doses for biohacking, skin lightening, or anti-aging goals, be aware that chronic accumulation of metabolites like 4PY may backfire, especially in older adults or those with metabolic conditions. Nicotinic acid, meanwhile, may still have a niche in lipid therapy, but given its lack of cardiovascular event reduction, its side effect profile, and its tendency to stir up metabolic trouble at pharmacological doses, it's more of a specialist tool than a general wellness panacea. Think prescription only, closely monitored, and definitely not mixed casually with your morning smoothie. In the end, all forms of B3 can be beneficial, but they are not created equal, and they certainly aren't risk-free. Your liver and blood vessels don't really care how clean your supplement label looks. What they care about is dose, duration, and your body's ability to safely handle the metabolic leftovers. So unless your doctor tells you otherwise, stick with food-based sources like chicken, mushrooms, tuna, and peanuts, or modestly dosed supplements that respect your thresholds. And if you're feeling extra scientific, maybe ask your doctor to check your methylation markers or 4-PY levels, just to make sure your health boost isn't a secret sabotage mission. Because if your body starts producing more 4-PY than it knows what to do with, don't be surprised if your endothelial cells start writing angry letters. And no, they won't be flush-free.